We have some question. It's not on diabetes, but it's about thyroid.
Okay.
And it's saying, is it possible to get off the thyroid medicine or it's a lifelong thing?
So unfortunately, thyroid is a lifelong thing because it's an autoimmune process and the thyroid gland gets destroyed. So it is lifelong.
Could you possibly show the herb slides and comments on efficacy of the herbs mentioned?
I put that slide in. It was more to talk about that herbs are not going to alone are not going to solve the problem. Whether you bring in cinnamon or you bring bitter gourd or a lot, because a lot of patients, especially Indian patients, they come in saying that they would like to just take herbs, and the sugars are 300, and it's the herb alone is not going to solve it. So you do need something else in addition to the herbs, regardless of what the herb is.
Thank you. Another question is about blood pressure, saying, do we have to take the blood pressure medicine lifetime?
Yes, so blood pressure, unlike like a cold, that if you took an antibiotic and you got better and it goes away, blood pressure comes down and stays normal because you're taking the medicine. The minute you stop taking it, it will go back up again because it's the vessels that constrict that's causing your high blood pressure. Now, if you don't treat it and you have diabetes, then you will also develop kidney failure from high blood pressure, or you will develop your retina will get involved, the eyes from high blood pressure. So it's important to control it. In fact, with diabetes, you want to keep it less than 130/80.
Yeah. I like the sample you showed with the amount of sugars into different food.
It usually has a good impact.
Yeah. So what will be somebody it's more like advanced stages of diabetes? How should their lifestyle should be, and how much it will help them to gain back the control with medicine?
So that's a good question. Once you have reached across the stage and you have all the complications, you can still make life a little bit better by just controlling your sugars. It will at least stop the progression. It might keep things more at the same level. Some of it may not get better, but at least it won't get worse. So you do want to take care of your diet. You want to meet with a dietitian, nutritionist, see where you can cut down on your carbohydrates, things like that, so that you don't end up on dialysis or any of those directions.
Somebody was saying, is there anything to do prevention? So
Yes,
it doesn't say
prevention
prevention of diabetes or prevention of complications, but
prevention of diabetes, definitely. As we said, that diet, physical exercise, and overall lifestyle changes is very important. How you sleep, what you eat, the amount of exercise you get. You want to stop if you're smoking, you want to stop smoking. If you drink alcohol, you want to maybe limit it or even cut it out. So those kind of things.
so there is a question. Somebody says, I take lentils in the morning. When I eat dinner early, then like you said, my sugar does good low. Is there any, if I lower lentils, that will help?
So Lantus is a medication that works for 24 hours. Its likelihood of dropping your sugars, it doesn't work for meals. It's working mostly on your nighttime blood sugars, on your liver from making glucose. That's how Lantus works. So maybe if you took it at bedtime, it might work better for you.
Then there is a question, is intermittent fasting recommended for 75 plus olds? And if yes, how to implement it?
Well, we do have a few patients who do it and who are 75 and 80 years old. So what you can do is you don't have to do the 8 and the 16. You could do 10. You can move it as much as you like. So you could do maybe from 10 to 7 and then just not eat from 7 to 10 or 7 to 9. So some amount of fasting is always good. Now, if you have very
So,
bad diabetes and you're on insulin, sometimes intermittent fasting can be very difficult.
right. So the other question is related to food. So I'll combine both questions in one.
Okay.
It says, is rice eating very bad? And then can a diabetic eat banana or oranges?
So a diabetic can eat everything. It depends on the amount of carbs that you're consuming. So all these carbohydrates are getting converted to sugar. So you can eat rice, you can eat oranges, you can eat bananas, you can eat whatever you want. But the thing is that you have to realize that the number of carbs in your meal is what's going to get converted into sugar. So if your meal has like a large number of carbs, like 60 to 80 grams of carbs, then all of that gets converted to sugar. So you want to limit it to maybe 30 to 40 grams of carbs. And so there are places to see like how much of 1 cup of rice would give you how many grams of carbs. And that's the amount that you can eat and sort of combine your food. At one time, we always talked in terms of kilocalories in a diet. Like if you went to a hospital, they would say, we'll put you on an 1800 calorie diet. Well, 1800 calories you can get from a chocolate cake, and 1800 calories you can get from a very healthy diet also. So it just depends on what you're putting into 1800 calories. So that's when that got converted into carbohydrates. And they started counting grams of carbs per meal. So for instance, if you have 2 slices of toast and a glass of milk, that itself is 45 grams of carbs. So your glass of milk is about, well, a little bit less than 45. It's about 12 grams. And each slice of toast is about 15. So that itself gives you 42 grams of, or something like that, of carbs. Now, if you added anything to that, you
Yeah.
put a jam, you put anything on it, you decided to eat a potato, I don't know, it will go up to 60. So if you don't understand carb counting, that's when all the problem occurs, because then all those carbs get converted to sugars. So whether you eat rice, you can eat whatever you want, but it's almost like somebody has given you, like $100, and you have to spend this $100 in the day,
Right.
and how would you spend it? So if you want to eat rice, then maybe at your next meal, you don't get rice. If you had a banana in the morning, then that's your fruit for the day. So if you give yourself a total number of carbs in the day, like I'm going to eat 100 grams of carbs in the whole day, then how do I divide those 100? It's up to you. But if you take all 100 at one time, your sugar is going to be 300.
Yeah.
So you have to have it as 30, 30, 30 or something of that sort.
I believe that's where the continuous glucose monitoring is
Right.
helpful.
That's
See.
where it comes. Because if you would look at your sugar after eating the 100 grams of carbs, they would be 300. But at the same time, now you finished your quota for the day. So in the evening, if you had no carbs and you decided just to eat, I don't know, a salad and maybe a bowl of dal or something, you will notice that your sugars are much lower, and you may not even need to give your, if you're on insulin, you may not even need it. So the insulin that you're giving yourself, the person who's on the Lantus, it's actually, the insulin you're giving yourself is the amount of carbs that you are consuming. It's an insulin to carb ratio, as we call it. So if you're going to give yourself, if suppose you're going to consume, your carb ratio is say 1 to 10, and you are going to consume 30 grams of carbs, then you would give yourself 3 units of insulin, is what you're really needing.
So do you see any variability that some people, they respond differently to eating rice versus
Yes.
food?
So the thing is that's where it comes as the glycemic index of food.
Yeah.
So whether you eat brown rice or white rice, you eat a brown bread or a white bread, it is how it is metabolized. That is where we talked about in the continuous glucose monitoring of time in range or time in target. That 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 glycemic index goes so high, or the sugar gets so driven up so high and for so long during the day, that you're high for like 5-6 hours, versus in something else you may be high only for 2 hours.
Right. So there is the question is, also how long one has to wait to after dinner, especially to check your sugar.
Usually about 2 hours with
Right.
most meals.
And any what's the range it should be after dinner?
So I tell most diabetic patients that if you can come back close to 100, that's great. If you can't, then at least keep yourself less than 140 or 150. Once you start crossing 180, it goes into your kidneys.
Right. Now the another question is about approximate cost for the sugar monitoring, the CGMs.
So the freestyle monitors, the one that you saw on the arm, is about $50, $60 a sensor if you paid by cash.
Yeah.
And it's about $110 a month. So
That's
in a year,
quite
it's your
reasonable.
ticket to India. Okay. It's about $1,200. So just think that it's a one ticket to India. You paid somebody to go to India. Which I think is totally worth it.
Yeah, it is. Now, one question is with intermittent fasting, will intermittent fasting pack more calories into fewer meals and therefore make sugar
So we had,
spikes
so that's a
taller?
good question, because we had there was a boy who came, he was, I think, 21. And I said, you should do intermittent fasting. You eat between 11 and 6 or 7. And he said, oh, that's easy. Okay. And then the next time he comes and he is 7 pounds heavier. And I said, what happened? Oh, he said, you didn't really kind of tell me what I'm supposed to be eating. So I was eating all kinds of good food in between 11 to 7. So yeah, you still have to keep your diet very strict. You can't eat like a pack of donuts or whatever, your diet has to be very healthy. Yeah.
Now, another question is how many times should one take sugar reading in a day?
As many times as you can. The more you see, the more you know.
So now, when one should decide they need to go on CGM and what will be their steps to approach and get one for themselves?
So if you talk to your primary care physician and you feel like you want to monitor yourself and you feel like you have a strong family history, maybe, that's a way to say it, that I have a strong family history and I would just like to prevent it, and if you're willing to pay for it, that's fine. An insurance company is not going to cover it unless you are on some diabetic medications, if you have commercial insurance, and Medicare will not cover it unless you are on insulin. You have to be at least on one shot of insulin for Medicare to cover it. But if you just want to pay for it and you want your doctor to write it, I don't think that they would object. But a lot of doctors' offices don't know how to download it and they don't know how to interpret it. That's the problem. So people like myself can help you.
Right. Now, this another question is interesting. Is it necessary to take daily sugar reading if HbA1c is below 6?
I think that's a personal choice. You don't sometimes have to do it every single day if you feel that your sugars are very well controlled and you're eating kind of the same things and you're pretty athletic and walking every day and taking care of yourself. You will probably get away with 3-4 times a week as long as things remain stable.
So now also think little bit on the complications and complicated diabetes, because you see a lot of those. So one thing is how people, means one obvious thing is they control their blood sugar, but what will be something people can do to avoid going into complications and how to manage?
Everything that you did for pre-diabetes is what you would do in this stage as well. So the more you focus on your diet, what you eat, your exercise, your sleep, and everything, that will prevent you from having those complications. It's the same thing. At the end of the day, it becomes the same thing.
Right. Are there any special support groups and things which can help into
so just
these
like
particular?
CWC has probably a support group. I'm sure hospitals.
Yeah, we have through the CWC.
Yes, and hospitals have support groups as well. Yeah.
Wonderful. So a lot of engagement. So anybody has any more questions for Dr. Archana, please go ahead. And what do you think of the role of millets and all these foods in the sugar
So
control?
a lot of questions come about quinoa and
Yeah,
quinoa being as a substitute. Quinoa is the only grain that's a protein.
right.
And it is a lot of people substitute rice for quinoa, which
Right.
it's fine. I mean, if you're that's a good way to go about it. If rice is a huge important part of your diet, then you do need it, then yes. um, so yeah, any kind of millet will actually help you, but quinoa is the only one that's a protein.
Protein. The other question is, any extra precaution should a diabetic patient take if he has CVD and hypertension?
um, So precaution wise, I think it's the same stuff, except that there is a new set of drugs that they
Hmm.
can be on, which are called SGLT2 inhibitors. The ones that I mentioned before, the Jardians and the oh my God, Farxiga and the Invokana. They
Yeah.
actually have cardio as well as kidney protective value. So those are something that if you're not on it, you might want to talk about it to your physician.
So there are two questions. I will fuse them. They are kind of similar. So one is diabetes reversible? And can you comment on relative efficacy of diet, exercise, sleep, etc. on managing pre-diabetes?
Oh,
So
so
both
yes,
two
diabetes
two
is kind of
extremes.
reversible. It is reversible. Um, if obesity is the main cause of it, then weight loss becomes your biggest component. As I had mentioned, you would lose about, if you lose even 7%, 10% of your weight, if you lost a significant amount, then you can actually get rid of it. Um, there are people who are morbidly obese who end up going for gastric bypass surgery and things like that, where they lose 100 pounds. And so essentially, weight loss becomes your biggest help. As long as you can lose it, that helps you to get rid of diabetes as well as hypertension. Um, but And of course, diet itself would change a lot of things. A very low carb diet, a whole food plant based diet, something that has minimum carbs, will definitely help you to reverse it. So
Now, if somebody gained weight because of the steroids or maybe insulin and things, what will be the best way for them?
now, if they had to continue being on steroids, we say they're asthmatic or whatever,
Yeah, yeah,
then they would need some insulin to help them to overcome that diabetes, because steroid induced diabetes is a little bit different than just diabetes which occurs because of insulin resistance, because once the steroid effect goes away, the sugars will come down.
And what about the weight gain because of the insulin long-term use and things?
So again, it all boils down to exercise. There's not a whole lot. There are drugs that are there out there to help you sort of combat that weight gain of insulin. So we have a lot of patients who are on high doses of insulin, and then they take something called a GLP-1 analog, which are like Trulicity or Ozempic and things like which you've probably seen on TV. So
Right.
what they do is that they cause you to feel less hungry, and they so less hungry, and they help your insulin to get released from your pancreas and your liver to make less glucose for yourself. So overall, your sugars come down, you feel less hungry, you feel full kind of most of the time, and you lose weight.
Very nice. And it means the people should go for medically supervised weight loss if they gain weight during because of the diabetes and things, or
Well, if you're diabetic, it's probably best. I mean, diet and exercise will definitely help you. Um, and if you can do it on your own, that's fine. If you do need somebody to guide you and push you along the way, then yeah, then we have some people who like to be seen every month and every 6 weeks to be cheered on, and then we like some who like to, just don't bother me. I'll come in and see you in 3 months, and I'll be fine. So it depends on how you are as a person.
so I believe the support groups are probably key
Yeah,
resource maybe
it
in
depends
this
of
type.
what type of a person you are and what you really need.
So the other question is, do you have any preference over DESCOM or says about CGM? Which one?
So the freestyle is a lot easier to obtain. It's you just need a prescription. If you go to India, you can actually buy it there. It was actually made in India and in Bangalore,
Wow.
so you can actually buy it in India and you'll be fine. So it's a lot easier to obtain. For Dexcom, you have to have you have to go through a company, and it's a longer process. But the Dexcom, I think, as a machine itself, is a lot more sturdy, and it's somehow it has better. It has less of this variabilities and all those kind of things. The
Right.
numbers are a little bit more concrete.
Right.
Yeah.
Then somebody is asking, it's Jardine
Jar-
and Synjardy is a GLP-1 medicine.
No, so Jardiance is an SGLT2, and Synjardy is a combination of Jardiance and metformin. So there is no GLP-1 in this. The only GLP-1s that are available are the injectable ones, Trulicity, Ozempic, and then there is an oral one, which is called Ribelsis.
Excellent. Thank you so much. So anybody has any last questions, please feel free to share to be answered. And meanwhile, Dr. Archana, I will request you to maybe give us some key takeaways for this session.
I
There's
have
a lot
so
of
many
wonderful.
patients who sometimes I feel they just come so late to me and for help. And I feel that a lot of these people could have just benefited from just regular exercise, eating healthy, of refraining from alcohol, don't smoke, just sleep every night, lead a good, healthy life and eat everything, but eat it in a moderate proportion. You can eat rice, you can go and have fruits, you can enjoy everything, but just keep it within some kind of a limit. And, you know, um, unfortunately, we can't change our genes, but we can change what we can change.
Yeah.
So, and those are what we put in our mouth and whether we move ourselves or not.
Right.
So, and that's very important.
Last question, which popped up saying, any herbs you prioritize with your
So I
experience?
usually put people on losartan. It's usually covered by everything. So, but there are lots of other ones out there. They're all pretty good. I mean, you can use olmesartan or whatever, whichever one you prefer. But I mean, it's good to be on something.
All right. And food-wise, any specific thing you notice, like cinnamon, the bitter gourd,
We
like
have some people who take cinnamon. They'll take they want
bean?
karela. They want some, and these kind of things do help. It depends on what stage of it that you're in. But remember that your body has been given beta cells, and those beta cells have to live for you to have insulin. So cinnamon and beta gourd is not necessarily going to keep your beta cells alive. They might just help you with your insulin resistance, and to keep that low. So you still, if you are going to develop diabetes because of a genetic predisposition, it may happen inevitably anyway.
So one question is about the fat also, right? The intake of the fat and oil. So what's your take on that one?
So fats always delay glucose absorption, but
Okay.
fats in, like say in a high a keto diet is full of fat. It has no carbs. And so, but if you just decide to have a lot of fat, it's going to go and probably layer your coronary vessels, which probably in the long run is not going to be very healthy. So the healthiest diet that you can choose for yourself is a whole food plant-based diet if you can adhere to it. There are some people I say that if you can't do it 100%, maybe do it 70%, keep yourself even out of 7 days, even if you are in that diet for 4 days or 5 days, that's better than nothing at all. And you will notice a vast difference.
Very nice. All right. Thank you so much